In psychoanalysis and psychodynamic theory, childhood experiences are seen as the cornerstone of psychological development. These early interactions, especially with primary caregivers, shape the internal world of the child and influence personality, emotional regulation, defense mechanisms, and adult relationships. Unresolved childhood conflicts often manifest in adult life as anxiety, depression, or relational difficulties. Understanding these roots is central to therapeutic work in psychoanalytic and psychodynamic counseling. Sigmund Freud, the father of psychoanalysis, proposed that early experiences during childhood, particularly those related to instinctual drives and relationships with parents, form the foundation of personality. According to Freud, children pass through a series of psychosexual stages: oral, anal, phallic, latency, and genital, and disruptions or fixations at any stage may lead to psychological issues in adulthood. For example, fixation in the oral stage may result in dependency or oral behaviors, smoking, overeating. Unresolved conflicts in the anal stage may manifest as rigidity or control issues. Phallic stage issues, often related to the Oedipus-Electra complex, can influence self-identity and relationships. These early developmental conflicts become internalized and may remain unconscious, continuing to influence behavior until addressed in therapy. Attachment styles and childhood experiences. Attachment theory, developed by John Bowlby and Mary Ainsworth, complements psychoanalytic ideas by emphasizing the importance of the caregiver-child bond. The quality of attachment formed in childhood affects emotional regulation and interpersonal relationships throughout life. Secure attachment results from consistent, responsive caregiving. The child feels safe and confident to explore the world. Insecure anxious attachment arises from inconsistent care. Individuals often fear abandonment and seek constant reassurance. Insecure avoidant attachment results from emotionally distant caregiving. Individuals may suppress emotions and avoid intimacy. Disorganized attachment linked to abuse or neglect. Individuals often experience confusion, fear, and unpredictable behavior in relationships. Adverse childhood experiences, ACEs, such as abuse, neglect, or parental loss can disrupt secure attachment and contribute to the development of maladaptive defense mechanisms and personality difficulties and even adult life physical diseases. Defense mechanisms and their role in childhood trauma. Defense mechanisms are unconscious strategies the ego uses to manage anxiety, conflict, and unacceptable impulses. They are developed in childhood as adaptive responses but can become rigid or maladaptive in adulthood if unresolved. Here are key defense mechanisms often seen in individuals with early emotional wounds. Repression, unconsciously blocking painful memories or emotions from awareness. Denial, refusing to acknowledge external reality or emotions that are too distressing. Projection, attributing one's unacceptable thoughts or feelings to another person. Rationalization, creating logical explanations to justify irrational behavior or feelings. Idealization, overestimating the positive qualities of others to avoid dealing with disappointment. Compensation, emphasizing strengths to cover up perceived weaknesses or failures. Fantasy, escaping reality through imagination to fulfill unmet emotional needs. Minimization, downplaying the significance of painful events or feelings. Undoing, trying to cancel out an unacceptable thought or action by engaging in contrary behavior. Isolation, detaching emotions from thoughts to avoid distress. Sublimation, channeling unacceptable impulses into socially acceptable activities, art, sports. Intellectualization, over-relying on logic or abstract thinking to avoid emotional distress. Reaction formation, behaving in a way that is opposite to one's true feelings. Regression, reverting to earlier developmental behaviors when stressed. Displacement, redirecting emotions from a threatening source to a safer target, yelling at a pet instead of an abusive parent. Humor, using wit to express or deflect difficult emotions. In psychodynamic therapy, identifying and interpreting these defense mechanisms helps patients become aware of their unconscious strategies and develop healthier ways of coping. Working with individuals who have experienced childhood trauma requires a thoughtful and emotionally attuned approach. Psychodynamic counseling explores how early experiences and unconscious processes influence current functioning, especially in relationships and self-perception. Key tools and concepts include 1. Exploration of transference and countertransference. Transference allows the therapist to observe how the client projects early relational patterns onto the therapeutic relationship. Countertransference, if managed well, provides valuable insights into the patient's emotional world. The therapeutic relationship itself becomes a microcosm of the patient's early attachments and unresolved conflicts. 2. Good management of countertransference. Therapists must be self-aware and reflective, using supervision and self-analysis to ensure that their own emotional responses do not interfere with treatment. Skillful management allows countertransference to become a tool for empathy and understanding rather than a source of distortion. 3. Empathy and reflective skills. Therapists must provide a non-judgmental, containing environment. Reflective listening and emotional validation help patients feel understood and begin to process early traumas. 4. Active listening requires full attention to verbal and non-verbal cues. Involves being attuned not just to what is said, but to what is not said. Pauses, contradictions, slips, and silences are often rich in unconscious content. To work effectively with clients, especially those with complex developmental histories, psychodynamic counselors must develop and maintain the following skills: emotional attunement and empathy, curiosity about unconscious meaning, patience with ambiguity and resistance, ability to contain intense affect, consistent use of reflective and interpretive techniques, understanding and navigating transference, countertransference, dynamic sensitivity to trauma and its developmental origins in both classical psychoanalysis and contemporary psychodynamic therapy. Childhood experiences play a crucial role in shaping adult personality and behavior. Adverse childhood experiences often give rise to specific defense mechanisms and attachment styles that persist into adulthood. Understanding these connections allows therapists to explore unconscious dynamics compassionately and insightfully. By integrating empathy, interpretation, and relational depth, psychodynamic counseling provides a path for healing early wounds and fostering greater emotional resilience and self-awareness. While not without limitations, such as being time-consuming or emotionally intense, psychodynamic approaches offer a profound framework for understanding the lasting impact of childhood and the potential for personal transformation.